So these are the second part of your video, which is under the topic of anti-tubercular drugs, and here you will see the classifications of this anti-tubercular drugs and little bit the mechanism of actions of these drugs. So let's see now. The first one is since it has been divided into two types, that is your first line drug and your second line drugs. Your first line drugs, it has been classified or divided into this type of group: your isoniazide, rifampin, rifabutine, rifapentine, ethambutol, and pyrazinamide. And your second one, that is your second line drug, these are the drugs or the medication which should only be used in a patient which is unable to tolerate the first line medication, or in case of the organism resistant to the first line medication. The drug under this group are your streptomycin, quinolones, your capromycin, cycloserine, PAS, that is your para-amino salicylic acid, ethoniamide, and amikacin. These are the drugs which is under the second line drugs or the second line drug group. Now we will be seeing their mechanism of action, how these drugs work in the body. Here I will be telling only the mechanism of actions of few drugs, not all the drugs but only the few drugs, since there is no time you will be getting boring. So let's see the mechanism of action of isoniazide. What are the mechanism of action? As you know that isoniazide, it is a bactericidal, as I already explained in before, that it inhibits the DNA synthesis of mycolic acid, which are important components of the mycobacterial cell wall. It is also the most active drug for the treatment of tuberculosis, a product which means it requires activation by the enzyme, that is your mycobacterial catalase peroxidase CAT-G. After orally administered, it will be well absorbed, widely distributed in the body, and good CNS and macrophage penetration. That is your mechanism of actions of isoniazide. Let's see from the another drugs, that is your rifampin. Mechanism of actions: they bind to the bacteria DNA dependent RNA polymerase, and thereby they will inhibit the RNA synthesis. These are the mechanism actions of the rifampin. The another drug is Rifa Pentane. This have the same mechanism of action as your rifampin, that is it inhibits the RNA polymerase. About the pyrazinamide, these are, as you already know, it is a bactericidals, in a group of bactericidals. So it is used in combination with INH and the RFP for short-term therapy to exert its activity, which is again residual intracellular organism that may cause the relapse. Ethambutol. The mechanism of actions of ethambutol is that it interferes with the RNA and also with the protein synthesis, which required a growing organism. For the second line drug, that is your drug will be your streptomycin. Here you will see the mechanism of actions of this drug are that they will inhibit the protein synthesis, that is this streptomycin also falls under the bactericidal group. For your capromycin, they are also under the bactericidal group. The mechanism of actions of this drug, it means that they bind to the mycobacterial ribosome and inhibits the protein synthesis. Cross the resistance with the streptomycin is possible but not so common. The next drugs will be your cycloserine. Their mechanism of action, it inhibits the cell wall synthesis of the bacteria. Ethoniamide, they will block the synthesis of mycolic acid, means their mechanism of action, it usually block the synthesis of mycolic acid. The last of the drugs which I am going to give the mechanism of action is your para-amino salicylic acid, or in short as a PAS. Their mechanism of action, they are the bacteriostatics, that means it will just interfere with the mycobacterial folate biosynthesis. They have been used safely in pregnancy, however no study available in human till date. So this is it for the classification and the mechanism of actions of anti-tubercular drugs. Let's see for the next, that is your one compounds of the anti-tubercular drugs.